Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
With February being Heart Health Month, we're here to talk a little bit about valve disease, a topic that I don't think normally people associate when it comes to heart health. Can you tell me a little bit about what is valve disease and what causes it?
Valve disease is disease of the valves of the heart. And the valves of the heart are little parts of tissue that are meant to open to allow the blood through the various chambers of the heart, but then close and stop that blood flowing backwards. So that allows the blood to continuously move in a circular motion through the body. Valve disease happens when these valves don't work right. So the two things that can go wrong is they either don't open well, so they impede the blood going through them, make it difficult for the heart to push the blood through the valve, or they become leaky. So as the heart contracts, some of the valve goes backwards through the valve like it shouldn't.
So is this something that typically affects just the elderly population, or are there other demographics that this disease targets?
That's an excellent question, and in fact the demographic varies from country to country. Worldwide, one of the most common causes of valve disease, and that is valve disease that affects the young, children and teenagers, is rheumatic fever. By far the most common reason for valve disease in this country is just senile degeneration. That means that with age, these valves just wear out.
What are there as options for treatment here in the United States? And specifically, I know you've mentioned that there are some new treatments coming available, especially here at the hospital.
Medications can be used in the early stages. So what we then do is put in a stent. And a stent is a metal mesh that can stay in there and hold the diseased valve open. The clever bit about it is that within that stent, there are sutured parts of animal tissue, which are very much the same as the surgically implanted valves, that act as a brand new valve, and that works immediately and opens and closes like a normal valve and essentially treats the problem. For the high-risk patients who could have had surgery but are at high risk, it presents a way of fixing their valve that can be done with a less invasive approach. The hospital has already invested in a very nice new hybrid OR room where we can do these procedures percutaneously, but also with a minimally invasive chest approach.
For more health news, stay tuned to Health Watch, or you can check on chartertv3.com and click on the Health Watch page. I'm Caitlin Tivnan. Stay healthy.